I initially had great results with minoxidil, but it's no longer working. What happened?
Minoxidil is a very popular hair loss treatment which is easily available and doesn't require a prescription. Both men and women can use minoxidil for genetic pattern hair loss. However, it is common for people to find minoxidil to be limited in effectiveness or feel that it worked for a while and then stopped working. I'll discuss the role of minoxidil in the treatment of hair loss and how I make decisions about its use in consultation with patients about hair loss every day in my practice. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Managing hair loss has been a significant part of my practice, beginning with surgical hair transplant and developing strategies to maximize hair coverage after transplantation. In an effort to improve the outcomes of hair transplant surgery using a material called extracellular matrix, around 2011 we started to apply regenerative medicine technology to non-surgically treat male and female pattern hair loss, which we refer to as TrichoStem Hair Regeneration. This non-surgical treatment made a significant impact on both male and female pattern hair loss, resulting in us helping people with hair loss who come in from around the world. In fact, we made a major impact on the management of female pattern hair loss, which prior to our work was treated mostly with minoxidil with limited benefit. Minoxidil was originally a drug used to treat high blood pressure. A side effect of the drug was the stimulation of hair growth. The drug soon became more popular for topical hair loss treatment. Minoxidil is available over the counter as a liquid or foam. Customized solutions are sometimes available through doctors, but the higher percentage concentration does not necessarily mean more effectiveness. Common side effect of topical minoxidil use is scalp irritation and redness. Many men and women have found minoxidil to help with their hair coverage, at least in the short term. At the same time, many people also find that it really makes no difference with their hair coverage. It's reasonable to conclude that minoxidil does not work for everyone. While the exact mechanism of how minoxidil works on hair is not known, it appears to delay hair shedding and extend the hair growth cycle so users have more hair on their scalp at a given time. Minoxidil needs to be used daily to sustain any effect, and people who discontinue minoxidil often report significant hair shedding soon after they stop using it. Even with consistent daily use, hair loss continues to progress. In my clinical experience, especially with our experience after developing TrichoStem Hair Regeneration, I find minoxidil to be of limited value. Minoxidil can stimulate hair growth, but many users report that the growth usually consists of fine hairs that don't grow very long or never grow thick, and these hairs shed easily. In the case of male pattern hair loss, minoxidil does not affect DHT or dihydrotestosterone, which is important in male pattern hair loss. For women, minoxidil is one of the few hair loss treatments currently available. Of the two medical hair loss therapies available for men, minoxidil and finasteride, I find finasteride to be a more effective treatment since it blocks the formation of dihydrotestosterone or DHT, which causes scalp hair to thin. However, we've observed that even if finasteride can be used continuously, it is limited to primarily slowing down hair thinning with some benefit for regrowth. People who come to see us typically start treating their hair loss by first buying minoxidil and applying it. They come in because they recognize that they are still progressing and often will report scalp irritation. I evaluate every patient with microscopic photos and specific standardized digital photography. Having performed hair regeneration treatment since 2011, I've accumulated a lot of data and first-hand experience. At this point, I've developed a hair loss profile classification system which I use to customize treatment plans. Factors which I look at include gender, current age, age of onset of hair loss, severity of hair loss, medical history, and other hair loss medications and treatments. These are used to assign the patient a hair loss profile, which determines the formulations, delivery method, and treatment plan for hair regeneration. Although hair loss is progressive, with our treatment we've been able to stimulate hair growth, prolong the hair growth cycle, and induce thinning hairs to become thicker. As mentioned earlier, this treatment has made a significant impact on the management of female pattern hair loss, which previously was treated mostly with minoxidil. With our treatment plans in place, more than 99% of men and women see significant improvement in their scalp coverage. In contrast to minoxidil, which requires daily application, we are able to achieve long-term results ranging up to 5 years or longer with 1 or 2 injection sessions. Most of my patients do not stay in minoxidil after undergoing hair regeneration. Some people who have been on minoxidil I wean off slowly to avoid shedding related to sudden cessation of use. For male hair regeneration patients, I make a determination about their relative sensitivity to DHT or dihydrotestosterone and prescribe finasteride accordingly. Hair regeneration, hair transplant, or any other hair loss treatment are not cures for hair loss. Hair loss is managed. Hair regeneration is about maximizing hair growth and coverage for as long as possible. The effect of hair regeneration working can be seen as early as 3 weeks. However, there is continuous improvement which goes on for 15 to 18 months before the hair coverage appears to be stable. As far as treatment recovery is concerned, most patients return to work the next day. We treat many patients who come from around the world, and many actually fly home the same day as their treatment. At a time where regenerative or stem cell-based technologies such as TrichoStem Hair Regeneration have been shown to be so effective, the role of minoxidil in the management of hair loss is of limited value in the treatment plans I provide for my patients. I hope you found this information helpful. Thank you for your question.